Okay, it's been such a long time since I streamed on since I used what you call it StreamYard to stream. So it's very possible that I just do a few funny things on this. Let me just connect this properly. Okay, let me make sure that I am audible. Give me a second. So let me see if this is, oh, yes, it is. Good. Okay, let me make sure that, yes, so I'm audible. Let me know if you have any audio connections, guys, please. Hi, welcome. Welcome if you're joining on YouTube, Facebook, LinkedIn. Guys, on YouTube, we usually have a regular slot Sundays or Monday for live streams, and this is up impromptu. So my apologies if you're not catching this live and you're catching us on the replay, that's fine. We've got TikTok. So if I look up like that, I'm looking at TikTok because that phone camera is just behind. How are you guys doing? I'm Dr. Sylvia. I'm a women's health general practitioner at Askaway Health. I'm the lead doctor at yourgpconsultation.com. That's an online health consultation platform for women's health, sexual health for people based in the United Kingdom. Welcome. I hope you're doing well. Thank you so much for clicking on and joining this stream. Today we are talking about paracetamol. I know this conversation about paracetamol, also known as Tylenol or acetaminophen, whichever brand name it has in your area or country, because I know this is this is like a global conversation now. Plus, its safety in pregnancy. Please let me know if you can't hear me. Okay, let me share it. Put a comment somewhere. Where is my comment thing? Okay, put a comment or something. Just let me know. I'm not sure I'll be able to get through questions. I hope I'll be able to, but we're going to do a fairly quick one. And there is a bit I want to get through. But I felt by the time I do this in a talking head video and publish it, it might take a few more days, which, yeah, I just wanted this to come out now that the topic is, it's fresh and hot. Okay, as we usually do before we start our streams, we share a disclaimer, don't we? So I want to make sure that you are aware that we are doing this, and this video is for health education purposes only, to provide information. It's not intended to replace an assessment or diagnosis or treatment from your own registered medical provider. So please, if you have any specific questions that relate to your own personal health or your loved one or a family member, always seek the advice of your own physician or other qualified medical practitioner. And any statement or comment you're making throughout this video is to just help to generate a conversation, help to educate us better, because this evidence-based information I'll be sharing as a GP and a medical practitioner who is registered to practice here in the United Kingdom. Right, so that's our disclaimer done with. I wanted to make sure I say it up front because I tend to forget it. So why are we here? What's this? Why am I doing this live stream in the middle of the afternoon on a Wednesday when normally we should be doing things over the weekend or on Mondays? Well, as some of you might have heard, the American, and I don't know how you wouldn't have heard, but the American president on, was it Monday? What's today? Yeah, it was Monday, wasn't it? The week seems to have gone so quickly. It was on Monday that during a briefing in the White House, he made some statements that have got us, all of us, into a furore. When I say all of us, I mean both medical practitioners and our patients. Everybody in between is having a conversation around this. So I don't know if you haven't heard or seen this, maybe you've been under a rock, although to be fair, I didn't even realize what was going on until one of my viewers left a comment. Let me see if I can find that comment because I wanted to share it. Somebody just left a random comment on my channel and said, after one of my videos, and said, here after the Trump announcement. And I was like, what Trump announcement? What's going on? So as you can see, I did a video. I will share that. I'm going to talk a little bit about that. But I did a video a couple of years ago looking at paracetamol in pregnancy. And somebody happened to come across that video. So this was, I think I saw this yesterday. Was it yesterday I saw this? Or was it Monday? I think it was Monday, and they said they're here after the Trump announcement. And I started thinking, right, what Trump announcement? What have I done? Am I in trouble? Anyway, that was the first indication I had any winds of what was going on. So let me let's watch a video. Let's not take it from what people have said or something. Let's hear it from the man himself. Let us hear it live and direct from the White House. I hope this is going to work. I'm just going to put the video on screen with me, and then we can sort of have a listen, and then proceed with the rest of the with the stream. So guys on TikTok, I'm so sorry you're not going to see the video. You might hear the audio, but you're not going to see it because I'm playing it on the live stream, on the StreamYard up here. So you might hear it, but you guys have probably seen the comments. If you haven't, you can always search or come over to my YouTube, and then you'll be able to see it with us. So let us watch this now. Let me see if I can play this now.
Effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good, instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times.
Okay, so let me just break it there. And like I said, if you want to, oh, hang on, put me full on screen. And if you want to, if you haven't seen that at all, which I'll be very surprised by, or if you don't know what's going on, you can watch. I think I'm going to put the links of all the videos I referred to. YouTube, please don't strike me, because I'm just sharing this for the purpose of information and health education, and it is on a stream. I'm talking about it, so please don't strike my channel. Anyway, these are the comments. These are the comments that have prompted the current, should I say, questions, concerns, upset, worries around the safety of paracetamol, aka Tylenol, aka acetaminophen use in pregnancy. This is where it all started around. Now, don't get me wrong. This question has been going on for some time, because I did a video just on this subject a few years ago. But I wanted to let you know this is why we're here about it right now. And so there are people who are pregnant, women who are pregnant now, and their families worried about, can I use paracetamol? Is it safe to use paracetamol? Can I use Tylenol? Is it safe to use acetaminophen? Does paracetamol cause autism or ADHD? And there are many who are also going through the emotional turmoil and guilt, because perhaps they have kids in the family with ADHD or autism, and they're now thinking, oh no, is it something I did? Is it because I took paracetamol? This is really, this has really very serious implications. I think it's important for somebody or any one of us with a big platform and with any kind of influence to be very, very careful about anything that we say that can potentially impact any number of people, whether a small number of people or a huge amount of people, but clearly this is impacting a huge amount of people. So we're talking about, I know I mentioned autism, I think, on the title, but really it's about the effect of this medication on the brain and cause conditions such as autism or ADHD. So autism, as we're probably all familiar with, is a neurological disorder. It exists on a spectrum. So that means people can be affected to different degrees. And it affects the way that people behave or the way that they interact with the environment, they speak, and so on. It's that kind of condition that we're talking about. But before I go into the studies, because one thing I really want us to do is look at the studies associated with this. If I haven't said so already, would you please give this video a like if you're joining live? And if you're watching on TikTok, friends on Facebook, LinkedIn, YouTube, please like the video. I would really appreciate that. And on TikTok, of course, that'd be very good if you would encourage me by giving the video a like. I tend to forget to say that, but I would appreciate it. So before we get into looking at what the data says and then answering the question, because that's really where I'm going to. I don't really want to get bogged down by the political fluff and noise and all that. But you're asking me questions. I'm getting questions since all this came about. I'm having people ask, well, what should we do? And this is why I want us to have this conversation, so that you can explore, so you can have a discussion. If you're very worried, go and sit with your doctor. But in terms of what are the facts, what is the evidence, this is why I'm having this video. Please listen up if that is why you're here. But before we carry on, let me tell you a little story, because I think what is important, and not just in this situation, is interpretation and analyzing studies or research and being able to marry the research to our real lives. What does it mean? What's the relevance? Okay, this study found XYZ. What does that really mean in terms of real bread and butter? How should it affect the way I behave? Okay, so let me tell you a little story. I was doing some research. This is many years ago. Did a study, and it involved just observing people in a small restaurant. And I noticed that on some evenings where people ordered a lot of dessert, so they spent a longer time in the restaurant and ended up ordering dessert. There were also a lot of wet raincoats and umbrellas in the restaurant entrance. So the two observations. One, that when people are eating a lot or ordering a lot of these sweet foods and desserts at the end of their meals, you're also more likely to get a large number of wet clothes or raincoats at the door, at the entrance. So I was observing a relationship in my study that more dessert orders were happening alongside more wet clothes or raincoats, umbrellas, and so on. So what I'm trying to get at is when you hear the term, the study says X and Y were associated, or they were correlated, or there was a link, I want you to be able to distinguish that and ask yourself, does this mean that X caused Y? That's what we really need to get to. That's really the nitty-gritty of this if you want to explore all these studies that we're all being bathed with. Because you might, or I might have concluded, oh, eating dessert makes raincoats or umbrellas or your clothing get wet, because I'm seeing two events in the same situation at the same time. So why can't A cause B? Why can't X cause Y? But you know, and I know, of course, that doesn't make any sense. Eating dessert doesn't make it rain. So something else can be going on. And yes, of course, the other thing that is going on is that it's raining outside. People are coming into the restaurant and they're having their clothes wet because it's raining. And so maybe they finish their meal. Normally they'll be rushing out, but because it's raining, they stay a bit longer waiting for the rain to stop, and they might order more dessert. That sort of makes more sense, that those two things I've observed are happening at the same time, not because one is happening because of the other, but because there's something else that is happening that makes both events to be seen at the same time. So that rain is the hidden factor that explains why both things are happening at the same time. Sorry, TikTok guys. Okay, so if I want to map this, my years old experience, to this paracetamol / autism question, where the study says, oh, there's a link, oh, there's an association, increased risk associated with, or something correlated with, that we often hear. Assume that the first event when people ordering dessert is the same as taking paracetamol in pregnancy, okay? Then the second event is, that's the wet raincoat or the wet clothing, is that the child will later develop autism. Let's assume and replace those two actual things that we're considering in my story. So what we're saying is that the studies are saying, okay, they're looking and seeing that A and B are happening together, and they're happening more often than what you'd expect by chance. That's what the studies are saying, at least the older ones that we're referring to. And so we're looking at, there's a possible hidden factor that we may not be aware of. It doesn't mean, this study is not saying that taking the paracetamol by mom when she's pregnant equates to developing autism. They have not found, there is none of those studies, none, that have found that risk that can say this causes that. Not a single one of them. They have talked about associations, they have talked about correlations, they've talked about links. Yes, I'm not arguing with that. But there's a very big difference. They cannot boldly come and say, oh, definitely this causes that. No. But the importance of those studies is telling us that, okay, there's something going on. Let's ask more questions. And that is fair enough. This is what the scientific society, society and community do and believe. That's fine. But when it comes to how you at home or somebody at home who's pregnant, perhaps they have a headache, perhaps they have one of those niggly pains in the back or in the pelvis that happen because you're pregnant. And believe me, there are many of them. Pregnant friends and women in the comments, you will confirm for me that this is the case. Or a bit of a cold, perhaps an infection, a urine infection that's being treated. This might be something that you might need to take some paracetamol just to get a bit more comfortable. And somebody is trying to say that there's a link. Does it mean that it definitely causes it? No. It's that they're observing two things happening at the same time. And the question is A causing B? There is not enough information to say that they do. Okay, let me make this a bit simpler, okay? Because like I've said, if you see people eating dessert in a restaurant, it doesn't mean that it's the dessert that made it rain. It's possible that raining is what made those two things happen together at the same time. Okay, so when the research suggests that taking paracetamol and ADHD and autism in the child are occurring together, it doesn't mean that it's the paracetamol itself that is causing the autism. Perhaps there's something else going on that made the mom take the paracetamol. That's the consideration. And that is what a lot of these studies also reference. And they also reference the fact that it's a bit difficult to work this out. Okay, it's a bit difficult. Now, while I was talking, I prepped this because I wanted you to have this graphic in your head as we're having this conversation. This is my restaurant that I was talking about. I'm putting up a bit late. But I just want you to have that thought in your head about the possibility of two separate things happening at the same time, but the fact doesn't mean that they are caused, one is causing the other, or that one is a result of the other. So going back to the analogy, perhaps the reason the mom needs to take the medication is a high temperature or some kind of infection or a mental health issue, severe stress. Could that be the reason causing the condition, but which influences both the need for pain relief and developing the condition? So let me make it clear that it's something else, an independent factor, maybe stress. That's the rain. And it's that stress that causes the ADHD, the autism to develop. But it's that same stress that might require somebody to take this paracetamol because they don't feel well, they feel uncomfortable, and so on. That's the point I want to make. And I think it's important that when we hear the studies, listen very carefully to what they're saying. Many times they will not say there is a cause. They can't do that. They just can't, because that's very, very important. If you're establishing a cause, it means that your study has more than 99% said there is a clear cause. A clear cause. You know, I'm not sure what else can I use to demonstrate cause. You know, for example, let's see. If I decide, okay, maybe I go out and it's a very cold day and I don't wear my earmuffs, I don't wear a jacket, and it's very cold. And then I come back and I fall ill. Literally within a couple of hours, I feel ill, not very fine. There's a clear cause. I went out without protection, without protective clothing, come back feeling ill, unwell, clearly. Or somebody becomes dehydrated in very hot weather, clear cause. Hot weather, dehydration, clear cause. That's not the case in these studies. I don't want to overlabor the point. Let me just, give you another example or metaphor, and then we can summarize. And I will assume that we have cleared this situation about interpreting or understanding the way the data or the studies are reported. So this one is the classic one. You know how the cock crows at dawn, okay? The cock crows at dawn. So if you didn't like my metaphor about my study, that's fine. The cock crows and then the sun rises. We all, from childhood, we associate the two things. Cock crow, oh, dawn, sunrise. Is it the cock that caused the sun to rise? See, was it the cock's crow or the rooster crow that caused the sun to rise? Yes or no? They're both happening at the same time or around the same time. They're both present. They're correlated. They're associated. They're linked because they're happening at the same time. But did one cause the other? No, you know that. It's not the rooster's crow that caused the sun to rise. We know that the earth is rotating. And so that's what you have, how you have your dawn and sunlight. And that impending dawn or sunlight is what causes the rooster to get up and then it crows. So there's another factor that is responsible for the two things that we're observing. So, in summary, okay, if a study finds a correlation or association or a link, it's like saying two things are happening together, okay? There may be something underlying, a shared underlying reason that is responsible for both things happening together, not that one is directly responsible for the other. It tells us that we have a lot more to find out about what is responsible for the condition, but it doesn't prove that one is related to the other. So let me leave that topic and let me take this off screen. I'm sure you're tired of my restaurant example. If you're just joining on YouTube, Facebook, or LinkedIn, thank you so much. If you've got a question or you want to tell me where you're watching from, that would be great. Good to hear from you. And we are talking about paracetamol and Tylenol and acetaminophen. Hi to the guys watching on TikTok as well. Okay, so the next thing I wanted to do is I wanted to share with you something, an old video for my channel. I call it an oldie but a goldie. Let me see if I can find the banner. So I'm not going to play the video. It's an old one. When I say old, it's about 4 years old or so. But I did this paracetamol in pregnancy video in 2021 because I was getting a lot of questions around the subject. I remember it was quite some time ago when someone came to see us, and she came with her partner actually, and I can't remember exactly what it was that the problem, but she was petrified, really anxious about the idea of taking any medicine. Hi, Marie, who says here to learn about paracetamol. You're very much welcome. That's what we're talking about, paracetamol in pregnancy. So she was really worried. And, I sat them both down and we had a conversation because I felt, wow, we're not asking you to take this. I know that most moms wouldn't just keep drinking paracetamol as if it's, jellies or sweets. Of course not. You would only take it if you felt you needed it. But I also know that, many women would do anything, of course, to protect their babies. And so you want to be very careful. Oh, I don't want to take anything if I don't need it, which is fine. That's not a problem. This is not trying to make you take a drug if you don't need it. But there are definitely many situations, many girls, many women who have pregnancy-related issues. It could be pain, it could be fever, that need to have this medicine and are frightened that they might be causing harm to their kids if they don't take them. And that's what we're here to talk about. So I was just saying that I've got a video on my channel, and this video, which I published in 2021, I was looking at a study that had just been published actually that same year from the European Journal of Epidemiology. So let me share my screen, and where is it? Because I want you to go through the study with me at the same time. Give me 2 seconds, guys. So guys, on YouTube, Facebook, LinkedIn, you're going to see my screen. It's from the European Journal of Epidemiology. Let me see if I can find, is it this one? Yes, it's this one. Okay, so let me share my screen. So hopefully, yes, hopefully you can see that. So let me go through. So this is the paper that I reviewed back in 2021, and I think it had just come out then. It was prenatal and postnatal exposure to acetaminophen in relation to autism and ADHD. It was a meta-analysis in 6 European populations, and a meta-analysis just means that they gathered together 6 different studies, and we're just trying to look at them, what was common in those studies, what can you conclude by putting those studies together, and so on. And it was quite a big, the eventual 2021 paper I reviewed is quite a big one because they looked at over 70,000 mother and child pairs. That's quite big. So when you're looking at a study like that, the first thing is, how big is it? That's, sort of gives you a bit of confidence that the information that you get could be fairly reliable. And I don't want to go over the whole study here because you can go and watch that video. I will link it in my channel. Eventually what they assessed was, or what they determined was, there is an association. They detected an association where there is a 19% increased occurrence of autism in mothers who took paracetamol, and 21% increased occurrence of ADHD. Like I said, a big study, fairly reliable. However, this is why I took the pain to explain my restaurant study with my dessert and my wet rain-filled clothes, and then the cock crow and rooster crow and sunrise thing earlier. However, they said that there were certain limitations. So they were saying, well, we're observing certain links, but we cannot categorically say this paracetamol taken in pregnancy is causing this problem. So it's not causing it, but they're saying we're seeing certain links. And they said the different studies use different test instruments, which is fair enough. So you can't equate you can't compare or equate one for the other because they use slightly different tools. Fair enough. But they also said something else that's important. They mentioned something called confounders. Let me just change the screen a bit and show this to you. They mentioned something called confounders. And what they meant was that they could not exclude or account for other factors that could be responsible for autism. So they mentioned things like the woman or the mom having a fever or an infection in pregnancy, having a chronic illness, mom, her age when she eventually had the baby, her weight before she got pregnant, whether or not she smoked, her mom's mental health, use of alcohol. They said that there were quite a few significant things which could also be implicated in autism, and they could not confidently remove all of those factors and then lay the blame solely at the door of taking paracetamol. So that's why I said it's really important when you're trying to interpret these studies to be clear what the information is actually showing. And I'm just seeing that it wasn't showing the screen I wanted to show, which is really odd. Let me remove that, and hopefully you should be able to see the screen that I was trying to show. I don't know why that's not showing now. So let me see. Okay. So if you are able to see this, that's good. If you're not, I can't really explain why. Let me put it back on. It was just a brief graphic anyway, so it may or you may not see it. It was just a brief graphic showing other things that could be linked to autism. This is not everything there. All this is ongoing research. Anyway, let us proceed. Let's proceed. So the point is that there was this study in 2021, and what they concluded was, yes, there's a link. We can't say it's exactly a cause, but we would like doctors and our patients to be cautious. They said that older studies had mentioned avoiding prolonged, persistent, and frequent use of paracetamol. In fact, they talked about avoiding its use for more than a 3-month period or 1 trimester, or more than 5 months during the pregnancy. So they mentioned all that as reasonable practices to guide women on how to use paracetamol in pregnancy. And most of the time, women do not even use paracetamol for that period of time. To be honest with you, you have to be under the care of a physician. If you have a particular condition, that means you need to use this pain medicine or fever medicine frequently, because the question is why do you need it so frequently? What's the problem? So you're under the care of somebody. Your doctor is looking after you and making sure you're not going above the recommended doses, and you're not taking a quantity that could put you or your baby at risk. All right, so that is the 2021 information. I will explain why I had to go back to that in a minute. So my conclusion in my video was, look, it is safe to take paracetamol if you need to take it at the recommended dose. In fact, it is not healthy for you or your baby to endure pain needlessly, or to endure pain at all, or even having a high body temperature, which could affect, of course, both you and the baby. So I made it very, very clear. In 2021, looking at the information that was available to us then, and we doctors continue to advocate use of paracetamol as a drug that is safe for pregnant women and for their children. And if you have any symptoms or concerns with anything persisting for more than 1 or 2 days, then come and see your doctor. Don't self-medicate. Yes, you can start it for 1 or 2 days, use a couple of doses, but if the problem is not getting better or it's getting worse, then you should seek medical advice. You should go and see your doctor, your midwife, whoever is looking after you in that pregnancy. Okay, so let's fast forward now to today, current studies. And the first one I'm going to share with you is something that was reported by Harvard scientists. So this is from Science Daily. Again, apologies, guys, that you can't see this on TikTok, but I will read it out because this is really important. And let me just share my screen. So it's a Science Daily publication. Let me bring it up. Bear with me. So remove this one. Okay. So let's share here. Science Daily. Yeah, I think it's that one. Is it that one? Yes, it's this one. Okay, so let me just double check that you're seeing the screen I want you to see. Yes, you're seeing the right screen. Okay, so I'm just going to read through it quickly. It's not very long. Bear with me, okay? Guys, don't forget to give the video a like. I know it's delivering value. I know it's a bit lengthy, but these things need explaining. So please don't rush it. Don't rush it and then watch 1 minute and then come and ask me, oh, doctor, is it safe to take paracetamol in pregnancy? I will tell you, please watch the entire video. I promise. I'll say it in a loving way, but that's what I'll tell you. Okay. Anyway, so this is from Science Daily. It says Tylenol in pregnancy linked to higher autism risk, reported by Harvard scientists. The date is September 24th, 2025. The source is from the Harvard T.H. Chan School of Public Health. And the summary, it says researchers reviewing 46 studies found evidence linking prenatal, that is before birth, acetaminophen or Tylenol exposure with higher risks of autism and ADHD. The FDA has since urged caution, echoing scientists' advice that the drug be used only at the lowest effective dose and shortest duration. While important for managing fever and pain in pregnancy, prolonged use may pose risks to fetal development. Experts stress careful medical oversight and further investigation. So all this pretty story is basically exactly what we said in 2021. This is not new information. But let us read the story. And sorry about this ad. I don't know why these particular ads are popping up on my computer at the moment. Okay, so it says, when children are exposed to acetaminophen, also known by the brand name Tylenol or as paracetamol during pregnancy, they may be more likely to develop neurodevelopmental disorders, NDDs, including autism and ADHD, according to a new study. The study was published recently in BMC Environmental Health. Andrea Baccarelli, Dean of the Faculty of Harvard School of Public Health and Professor of Environmental Health, was a senior author. The study was led by the Icahn School of Medicine at Mount Sinai and also included co-authors from other institutions. The researchers analyzed results from 46 previous studies worldwide, so they were doing a meta-analysis again, that investigated the potential link between prenatal acetaminophen use and subsequent disorders in children. They used the navigation guide systemic review methodology, a gold standard framework, which enabled them to conduct a rigorous, comprehensive analysis that supported evidence of an association between acetaminophen exposure during pregnancy and increased incidence of NDDs. So I'm not trying to downplay the importance of their findings, guys, but I want you to be clear in your head. There's a difference between cause and association. Remember the cock crow or the rooster crow and sunlight and dawn. So when you hear that, please remember my analogy, okay? The researchers noted that while steps should be taken to limit the use of acetaminophen or paracetamol, the drug is important for treating pain and fever during pregnancy, which can also harm the developing baby. So while you're running away from the paracetamol, experiencing pain and fever could also be doing damage to the baby. Now, they even go on to tell us high fever can cause the risk of neural tube defects, so that's affecting the nervous system, the brain, and preterm birth. We recommend judicious acetaminophen use, that is, lowest effective dose, shortest duration, under medical guidance, tailored to individual risk-benefit assessments rather than a broad limitation, which all makes perfect sense. So judicious, be careful. If you use it for the first couple of days and you're not feeling better, please see your doctor. If you're feeling very, very ill, get advice from a doctor. If you're not sure, get advice from a doctor, basically. In late September, the FDA announced it will issue a letter to clinicians urging them to be cautious about the use of acetaminophen in pregnancy. Baccarelli said he had discussed his study with Health and Human Services Secretary Robert F. Kennedy Jr. in the weeks leading up to that announcement and provided the White House team with a statement noting his research found evidence of an association. You guys, listen, he didn't say cause. You see, that's the thing. It's a matter of the words. It's in the small print, okay? There's an evidence of an association. Does that mean a cause? They don't know. They're not saying so. They can't say that because they haven't found a cause. There are more questions that need to be asked. Yes, absolutely. But is there any evidence it causes harm? You could also ask the many, many women who also use paracetamol in pregnancy and their kids didn't end up with autism, could also ask the question, so what happened there? This tells you why there is need for more questions. Is there anything wrong with bringing out information and urging the public to be careful? There's nothing wrong with that, but you need to be careful how you deliver it because there are many people who may not wait around to listen to the explanation, just run with the first headline and decide, oh, I heard this, I can't take paracetamol. No, without listening to the evidence. And that's what we're worried about. Okay, so going on to read, where did I stop here? He says, noting his research found evidence of an association between prenatal exposure to acetaminophen and NDDs. The association is strongest when acetaminophen is taken for 4 weeks or longer, Baccarelli said. And the statement continued, we need to read all this. Further research is needed to confirm. Oh, yes, okay. So they're saying further research is needed to confirm the association. So they need to confirm the association and determine causality. But based on existing evidence, I believe that caution about acetaminophen use during pregnancy, especially heavy or prolonged use, is warranted. So to me, that you're not telling me anything new. You're really not telling me anything new about what I'll say to my patient. If there are people who, because it's an over-the-counter drug, take it, without any due regard, then yes, a cautious message about, being careful, stick to the recommended dose, don't take it for longer than a few days. If your symptoms aren't getting better, seek medical advice. That is useful information, but not to scaremonger the great majority of people who might use this occasionally for maybe 1 or 2 days in a month or in a couple of months to help with discomfort. And if they didn't use it, they'd be struggling and suffering because they've had some information that is really, really not factual, not based on any evidence that we have. Baccarelli noted in the competing interest section of the research paper that he has served as an expert witness for plaintiffs in a case involving potential links between acetaminophen use during pregnancy and NDD. I think that is it. Okay, so that is one of the recent papers. Let me take this out so you can, yeah. So that is one of the recent papers. They said, really, they haven't told us anything that we don't know. That is when I looked at that, I was like, well, we already know this, okay? So yes, caution, but there's nothing new in this finding that should make us all go, oh. So this is why I referred you to my video published in 2021 based on 2021 data or research, which said pretty much the same thing. Be careful. Don't use it frequently. Don't use it persistently. Seek medical advice. Be under the care of your doctor if you're pregnant and you need to take paracetamol. It's not new. Okay, but there's another one before you go. Let's talk some new data. So you might have heard of this because it's also been in the sound bites for many videos on YouTube or on social media. The famous Swedish study everybody's talking about. So let me share my link to this study. It's called Acetaminophen Used During Pregnancy. Let me try and find it. So let's take this one away, okay, and then share this study on share screen. Excuse me. So let us find the Swedish study. I think this is the one. Is this? Yes, this is the right one. So you should be seeing on the screen the acetaminophen used during pregnancy and children's risk of autism, ADHD, and intellectual disability. This was a study published in the Journal of the American Medical Association in 2024. Yeah, 2024. Okay. And it's a lengthy study, a huge study, over 2.4, I believe, million kids. Yes, 2.4 million kids born in 1995 to 2019 in Sweden, and they followed them through. For a period of time to assess the effect of acetaminophen. So this study, they weren't looking at other studies. They were actually studying people. They were studying individuals. They were not looking at, oh, this X study said this and Y study did that and Z study. No. They actually worked on individuals. Now, I'm not saying the other studies were bad. No, I'm not saying that. I'm just trying to create a distinction. So this was a 2024 one, and here are the results. And I'm going to put the link to the study. So if you really want to do your own research, go through the information. I'll put the link so you can find it. So you can see it's a lengthy study. But what I want to do for the sake of time is go through the results with you. So like I said, over 2.4 million. I'm going to take a few minutes to read through. So the first part of the results, they said in total 185,909 children, which is about 7.5%, were exposed to paracetamol during pregnancy. So about 1 in 13, that's 7.5%, isn't it? Yeah, 1 in 13 had moms who took acetaminophen or paracetamol while pregnant. Excuse me. The next line, it says, the crude absolute risks at 10 years for those not exposed versus those exposed to acetaminophen were, so this study was looking at autism, was looking at ADHD, was looking at intellectual disability. Okay, so these findings, one after the other, talk about these conditions. Let's just look at autism just for the sake of time. So when the researchers looked at the raw numbers at age 10, for the question of autism, they found that 1.33% of unexposed children were diagnosed versus 1.53. A grand big difference. And I'm not trying to be theatric or trying to downplay. No. But I just want us to think about the size. A difference of 0.2. 0.2% is the difference. So basically what this is saying is that when you look at the numbers of the kids that had autism, 1.33% of moms didn't use, in 1.33% of those kids, their moms did not use paracetamol versus 1.53%. It's not a huge difference. Okay, just put that in your pocket. I'm not going to go through ADHD and intellectual disability. That's on the in the report, in the paper, if you want to read it. Then they did something interesting where they compared, excuse me, they look at comparing people in the same family and in the same household. We call it sibling control. Sibling means a brother or sister. So they looked at models without sibling control, ever use, that is, if they ever used paracetamol versus no use at all of paracetamol during pregnancy. And they said it was associated with a marginally increased risk. So in very simple, straightforward terms, they first of all looked at an analysis where they didn't compare siblings, and they saw there was a very small link between if you used as paracetamol or not and a higher chance of developing this condition. And they said that chance of developing autism when you use paracetamol was very small. Then the next line, to address the unobserved confounding, they then matched full sibling pairs and analyzed them. So that tells us they now took into account where are the brothers and sisters or people that lived in the same household. So they have genetic connection, they have family, the same kind of family income. So they're exposed to pretty much the same circumstance. And so you can reasonably assume that they would end up with similar outcomes. So they did this test to, exclude those other things like genetics, family income, home environment. They compared children to their own brothers or sisters, where one was exposed to paracetamol during pregnancy and the other was not. So they did that in addition. That's what makes this study also quite beautiful. And they said they found no evidence that using paracetamol or acetaminophen during pregnancy was associated with autism, ADHD, or intellectual disability. So that small link that was present generally when they didn't do any sibling control, that link disappeared. It was small in the first instance, but when they now did a niche down comparison, it even disappeared. Okay. And then they said there was no evidence of a dose response pattern when they did the sibling control analysis. So they're looking at whether if you take more paracetamol, if your dose is higher, does it increase the risk? And they said they did not find any association with whether you're taking a higher dose of paracetamol will cause any problems. And so that led them to make a conclusion. So I'm talking about the Swedish study. It is dated 2024, just last year. It looked at over 2 million children. And these are the results that we've just been going through, and these are the conclusions that they were making. They said the more accurate sibling comparison suggests that the tiny increase in risk was likely not caused by paracetamol. It was probably due to other factors common to those families, maybe their genetics, maybe an underlying health condition that made the mom need to take paracetamol in the first place. So I know I've probably over-explained this and made it a little bit complicated, which I'm sorry about, but I'm just trying to explain something that I feel is really important in terms of the conclusion. So this is the conclusion for the Swedish study. Let me see if I can make this a bit bigger so I can, So the conclusion is paracetamol or acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability in sibling control analysis. This suggests associations observed in other models may have been attributable to familial confounding. So confounding, again, referencing the possibility of something else that's present, something else that could make developing autism more likely the case than with paracetamol. So we've looked at all the studies, we've looked at more recent studies, and we're trying to ask ourselves and answer the question, what should we be thinking? What should we do? If you're just joining in, thank you so much for watching this live. And I know it's outside of the usual time for my regular viewers, but please give this video a like. And of course, if you're watching on the replay, I would really appreciate your support. Help me to share this information. I think we need to get it across to as many people. We don't have a platform as big as the US president. So we have to do a lot of hard work to make sure that people get to hear this information, but I would really appreciate any support for doing this. Okay. In response to this, I was really happy that our health minister, Wes Streeting, mentioned this study at a recent appearance at a morning talk show here in the UK. Some of you guys might know Lorraine's talk show. And I think it's really useful that he referenced this. I'm going to play a little clip from this YouTube again. We're just learning. So don't penalize my channel for this. Let me see if I can find the video. What did I do with it? Hope I downloaded it. So this is, we've played the announcement, Trump's announcement. Okay, let me play this video for you guys, and then we will come back and conclude.
For parents trying to weigh up medical advice, knowing where to go for information is key. And mums at this East London Play Cafe aren't inclined to take advice on pregnancy from the world's most powerful man.
Himself, he's like a child. I took painkillers throughout my whole pregnancy. My family's taken painkillers throughout their whole pregnancies. And we've got a lot of children in our family. And we've got some who are autistic as well. I just don't think there's an actual link between the two.
What really makes me upset is that the people who will get misled by these comments. They're, in the medical world itself, you have to advocate for yourself, but there are many people who just don't know how to do that. And I think that these kinds of comments will trickle down into women who just don't have that kind of support.
The fear is they may now avoid the painkiller paracetamol, or Tylenol in the US, after this.
So taking Tylenol is not good.
Prompting a notably blunt rebuke from the UK's health secretary on daytime TV.
Don't pay any attention whatsoever to what Donald Trump says about medicine. We've got to follow medical science. We've got to follow the evidence.
And while the Harvard report cited by Trump reviewed other studies and found evidence consistent with an association between paracetamol and autism, a more in-depth Swedish study on more than 2 million children last year found it was a non-causal association, meaning there is no strong evidence and the medical advice remains emphatic.
Paracetamol remains the safest option for pain relief during pregnancy for women.
But for some, the damage is already done.
We've heard from parents today who are dropping their kids off at school and are concerned that they're being judged, and people are looking at them and thinking it's their fault that their child is autistic. This is not true.
Trust and safety always the first casualties when playing politics with medicine.
Okay, so we are not playing politics with medicine. We are here to talk. We're here to talk about what is evidence-based, what are the facts. So guys, what do you think? Where do you lie on this spectrum? What are the key takeaways? Let me just make sure that I'm audible, because on this spectrum, what are the key takeaways? Let me just make sure that okay, fantastic. What are the key takeaways? So please do not panic. Okay, if you haven't heard about any of this and you're just coming across it from this video, I hope I've provided some background so that you understand where it all started, how it started, where it came from, and so on. But the bottom line is, please don't panic. Speak to your healthcare provider if you're concerned. Taking Tylenol or acetaminophen or paracetamol, whichever term or name it goes by, a brand it goes by, where you are based, in its recommended doses, as directed by your physician, or if you're following the medication leaflet and it's just the first 1 or 2 days of a particular problem that you feel, oh, it's mild, not severe enough to come to a doctor, that's safe. Please do that. But if you need to take it for longer, if you feel your symptoms are getting worse or it's not getting better, please seek medical advice, okay? We always advocate for caution. Yes, even more so when you're pregnant, of course. But at this time, we have not seen any direct causal link. I have come across a few comments on videos I've seen on this where somebody was saying how autism has been around since, I can't remember how long autism has been around since, and how paracetamol was only detected, excuse me, how paracetamol was only developed in the 50s or something like that. I was like, okay, that's another strand to the conversation. But yes, I just want to highlight somebody left another comment on my channel. And the person said, in the recent development from Andrea Baccarelli, who I referenced in that Harvard paper, head of environmental health at Harvard. Oh, he says, is the recent statement from Andrea Baccarelli, professor of environmental health at Harvard, genuine? And if so, does your advice change? So this was in response to my first video. Well, I don't know what statement this person is specifically referring to, so it's a bit tricky for me to answer that question without knowing what exact statement. My advice in that video remains, I think I put it down, it was exactly at minute 543 of that video, I specifically answered the question, can I take paracetamol in pregnancy? Is it safe in pregnancy? And I answered the question, yes. And that is after I've provided background to the paper I was analyzing at the time, which really provides the same information as the meta-analysis that's just been referred to by the Harvard school. I think what is slightly different that they mention is not taking paracetamol for a prolonged period. I think for about 4 weeks, they mentioned in this paper that we're just looking at here. And again, my advice would be the same for anybody. It is avoid frequent, persistent and prolonged use. Avoid use without your medical doctor's supervision. If your symptoms are getting worse, please speak to somebody. But I will definitely say that what these studies are telling us is that we need a lot more work, a lot more research to look at all the other different factors and their relationship with the development of autism. We need to understand that more. But the way to go is not by fear-mongering or scaremongering. And you heard from those videos that I played earlier about how this is impacting people, both those who are pregnant and worried, or those who have kids with autism and are feeling, oh, is this something I did? That's absolutely unnecessary. I think my final point will be, please don't endure pain, fever, or any condition when you're pregnant because you're worried about some information that you haven't verified from a reputable source, evidence-based source. I would start with your own medical practitioner. You're already doing an amazing job bringing another human being into this world, and we should be supporting you in that journey. We should be providing you all the comfort that you need to go through that journey, not making you fear and worried during the process. Now, for those of us based in the United Kingdom, one more share I want to give to you. And if you're thinking about any medications, worried about you want to know side effects, you've not been able to get through to your doctor, you're waiting for your doctor to call you back, and you just want to explore medication side effects. You might have heard of this. The best use of medicines in pregnancy, BUMPS is the website. It's a UK website that lists all the different medications, talks about what they are, talks about their benefits, their risks, alternatives, the treatment. This is the paracetamol page that has just been updated this very month, so you can take this as given. And then it talks about benefits. What are the benefits? Is the first choice painkiller for use in pregnancy. Treating pain can help improve your quality of life, help you sleep. So that's good for you and baby. Treating a high temperature during early pregnancy may reduce the risk of your baby being born with a neural tube defect. Talks about risks. It says paracetamol is the best studied painkiller for use in pregnancy. There is no good evidence that it can harm your baby. You may have heard reports that paracetamol used in pregnancy might be linked to autism spectrum disorder, ASD in children. However, the highest quality studies do not show that paracetamol exposure in the womb causes ASD or affects other aspects of your child's development. Please go and have a look at this site. It's called Best Use of Medicines in Pregnancy. And it doesn't just talk about paracetamol, a whole list of different medicines. So UK-based viewers, that is one that you can look at. Right, guys, I think we should call it a job done. I would love to hear what you guys think. And what do you feel about some of these things that we've talked about today? Is this reassuring to you? Do you feel more worried? Do you think, there's a lot more concern in the space because of these conversations that we're having? What are you pregnant now and worried about using paracetamol? Please speak to your medical provider. Of course, you can always reach out to us here in the comment section. Don't forget again that what we're providing is general information and education to steer you in the right direction. We can't provide you with specific medical advice. If you're UK based, of course, you can book a consultation with me, yourgpconsultation.com, and link in the description box below. But I'm going to say goodbye now. Thank you so much for watching. I think my guy's on TikTok. I'm not sure exactly what's happened. Let me see. Okay. Okay. Let's see. Something interesting is happening. Okay. It said it detected inactivity. Okay. Right. So thank you so much for watching, guys. I'll see you again. Questions, comments, let me know. Give the video a like. Please share, or subscribe to the channel. That would be great. Lovely to speak to you guys. Lovely to see you, and we shall see you again soon. Bye-bye. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.